When a patient goes through an in vitro fertilization cycle, we know that their chances of getting pregnant are much better if we have more than one embryo to work with. But because of the concern of multiple births, we're typically not going to transfer all of those embryos back into their uterus during that fresh cycle. When we have embryos left over, then we're going to cryopreserve those embryos so that that couple can use them at a later time. If for some reason that couple doesn't use all those embryos, then we've got to make a decision about what do we do with those embryos at that point. And they have really three options that they can think about. One is to donate that embryo to another couple, either anonymously or in an open donation. They can donate those embryos to research, or they can choose to discard those embryos. And I think sometimes the most difficult part is making the decision about which way to go. There are a range of options in terms of donating embryos. Some couples may want to know something about the couple that's receiving their embryos. They may even want to meet that couple, and that would be more of an open donation. Other couples want to donate anonymously. They want to know that they've donated to another infertile couple, but they really don't want to know anything about that couple or even the outcome of that donation cycle. There may be couples who want to donate their embryos to research, and they may have a specific disease in their family that they're interested in, such as Alzheimer's or something like that, and they may choose to donate those embryos to a specific lab that's doing research in Alzheimer's in hopes of someday finding a cure for that disease. Another option would be to discard those embryos, and what that involves is just removing those embryos from cryopreservation and discarding them as you would any other medical tissue. We know that couples have a very difficult time deciding what to do with any embryos that may be remaining at the conclusion of their IVF cycle. So my advice to couples is from the very beginning to begin to discuss what those options are in case they do have embryos remaining that they're not going to use.